Dr. Delphine Kerob. I'm a dermatologist. I'm based in France, and I'm working as a medical director at Vichy Laboratoire International. Dermatology is a specialty that talks about the skin, and the skin is the interface between yourself and the external world. And the skin is not only an organ that is very important for your health, but it's also an organ of beauty, of interaction with the others. So when you have skin disease or skin conditions, it will obviously impact the relations that you may have with others. It may impact also your perception of yourself, and it can also impact your quality of life and your self-esteem. So it's very important when we have patients, dermatology patients, to understand what is the impact of their dermatology condition on their health in general, but also what is the impact of the dermatology condition on their self-esteem and quality of life, because we will adapt the treatments based on both aspects. There is a difference between the daily practice, where you just ask simple questions: how do you feel? What is the impact of your skin condition on your daily life? But there is also more standardized questionnaires that we use in clinical studies to have really objective measurements of the quality of life. And for example, the Skindex 16 is a quality of life measure that will assess 3 domains of your quality of life. The symptoms, such as stinging on the skin, burning, but also emotional. So how do you perceive your skin, what is disturbing you in terms of your appearance, and also functioning, how does it impact the relation with others. So with this set of 16 questions, then we make a global score, and then we can also compare the scores, the global, and the scores for each domain before and after any treatment that we give to the patient. So one of the most frequent concerns that we have is, of course, acne. So acne is very frequent among teenagers, but also more and more frequent in adults, especially in adults female. When you are a teenager, it's very difficult to deal with your acne lesion, but sometimes it's even more difficult when you are an adult and you still have pimples coming because you're not anymore a teenager and you want to be rid about that. We have also other dermatology conditions that impact a lot the quality of life. For example, vitiligo, especially in the darker phototypes, because the contrast between the depigmented skin and the normal skin is much higher, so it's really visible. And there are many other skin conditions, such as angiomas or rosacea, and I'm just talking about the conditions that are predominant on the face. But of course also other skin conditions affecting the rest of the body area can affect the quality of life, such as psoriasis, atopic dermatitis. And now almost all studies dealing with treatments include quality of life measurement to make sure that the benefit of the treatment on objective clinical signs is also correlated to patient-reported outcomes, such as quality of life or self-esteem.